Sex. It's good, it's fun, and it's exciting, and it's the only way to get an STD. STDs come in a variety of forms such as bacteria, parasites, and viruses. In 2015, in the UK, around 1 in 145 people caught some form of an STD.
First, we'll look into a bacterial STI. Syphilis. Syphilis is a bacterial disease which is classed as an STI. It can be caught either through sexual intercourse or passed from mother to baby. A common myth about syphilis is that the famous explorer Christopher Columbus returned to Spain after discovering the New World in 1493. He returned with a variety of new diseases, including the well-known syphilis. This is known as the Columbian theory. However, recent discoveries have cleared his name. Discovery of an ancient Roman burial site in Austria suggests syphilis was around in Europe a long time before Christopher Columbus was even born. The burial site contains at least 9,000 skeletons, some dating back to the 9th century. One skeleton, thought to be that of an 8-year-old dated to around 1390, showed signs of the disease on their teeth. Several other bodies have been found in the site that show signs of disfigurement, a common sign of syphilis. Syphilis can be a disfiguring disease with 3 stages of infection. Stage 1 usually occurs 10 days to 3 months after infection, noticeable by the appearance of painless sores on the site of infection, for example, the penis, the vagina, mouth, lips, tonsils, fingers, and bottom. Stage 1 can be easily treated and cured. She's happy because she doesn't have syphilis anymore. Leave stage 1 too long and it will become stage 2, also called secondary syphilis. Stage 2 shows flu-like symptoms, with non-itchy skin rashes on the body, usually the hands. Also the appearance of skin growths around the genitals. This can lead to hair loss, weight loss. Basically, you may look a little like Gollum. Leave stage 2 too long and it will turn into stage 3. Stage 3 can occur a few months or a few years after infection and is the worst of the 3 stages. This is the most disfiguring stage, causing facial deformities and bone mutations. Actually, it's so disfiguring there isn't a picture I wanted to show. Also, the disease in this stage can infect anywhere on the body, including the eyes, ears and mouth, and depending on where it affects constitutes different symptoms. These can be strokes, blindness, deafness or paralysis, and possible death. The treatment history to syphilis is rather colourful too. The 15th century doctors thought boiling mercury on an open fire while suspending the patient in a box above the fire would produce saliva to expel the disease. The side effects of mercury include mood swings, insomnia, abnormal sensations, tremors, muscle tissue wasting away, kidney malfunctions, respiratory failure, death, but at least you won't have syphilis. Actually, mercury had no effect on syphilis whatsoever. Other cures were tried but to no avail, so other methods of dealing with the disease had to be thought up. With facial disfigurement and nasal collapse being an unsightly mess, the artificial nose was introduced. However, a breakthrough came, the first surgical reconstruction. Gasparo Tagliacozzi invented the face flap. It was a procedure where the patient would have their arm strapped to the face and their arm skin would be attached to the remaining nose. After a period of time, the vesicles from the nose would fuse to the skin of the arm, allowing the arm skin to be removed, resulting in a new nose. Then came Julius Wagner Rareg. In 1927, he won the Nobel Prize for his research into using malaria to cure syphilis. This was regarded as the first effective cure. The high fever from malaria caused syphilis to be sweated out. So congratulations, you no longer have syphilis, but you do have malaria. After this, sweat boxes were invented and used as a cure, until the mass production of penicillin. In 1932, the Public Health Service, in partnership with Tuskegee Institute, performed a heavily criticised experiment to study the natural development of syphilis within 600 African American males, in which 399 had syphilis and 201 did not. The participants in the experiment had no idea they were even involved, with researchers telling them they were being treated for bad blood, a term used to describe many illnesses. The men never received any treatment for any disease. The experiment was only meant to last 6 months but lasted 40 years. In 1972, the Tuskegee experiment went public, causing an outcry. A panel was created to investigate further. They discovered that the men had been misled and no evidence of consent from the men had been provided. The men were never given treatment for syphilis even when penicillin became mass-produced in 1947. A $10 million settlement was reached during 1974 and lifetime medical benefits along with burial services granted to all living participants. Now let's dive into a parasitic STI.
Crabs. Not just your friendly crustacean found on beaches, it is also a parasite that can be contracted through sexual intercourse. Its real name, Virus pubis or pubic louse, was first thought to have existed at least 3.3 million years ago when it possibly jumped from ape-like species to our closest human relatives. That means that Lucy may well have gotten crabs. If you don't know who Lucy is, she is believed to be our earliest human ancestor discovered. They can grow up to 2 millimeters long and like to nest themselves in your pubic hair, chest hair, beards, and even eyelashes. They are mostly transferred by direct human-to-human contact, sometimes can be picked up from bed linen, clothes, and towels, but cannot be picked up from other animals, and they cannot infect your house like fleas, thankfully. The reason they can't infest your house like fleas is because they only can survive away from the human body for around 24 hours because they need our body heat to live. Because they can't jump like fleas, there must be direct contact for them to be transmitted. These little critters live for around a month. They start their life as tiny little eggs that are attached to the hairs by their mother. These are called nits, and a female will lay around 30 of them. They start their life as tiny little eggs that are attached to the hairs by their mother. These are called nits, and a female will lay around 30 of them. Another reason they need us to survive is because of food. When they are feeling peckish, they will bite you, but only so they can get to your blood. They will happily drink your blood 4 to 5 times a day, like tiny little exoskeletal vampires. The Brazilian hypothesis. Although there is a correlation with the increased lack of pubic hair due to grooming fashions over recent years, with the decrease in pubic lice cases, it is admitted that the research does not contain enough detail about other factors that could account for the drop in recorded lice victims. The signs and symptoms if you do have pubic lice is itching, inflammation, and tiny blood spots around the groin, abdomen, and thighs. This is because of the biting they do. You may also discover what looks like black powder in your pants, which is, you guessed it, tiny little crab poos. You can prevent the transmission of crabs by hot washing clothes, bedding, and towels. If you do find that you have pubic lice, over-the-counter lice shampoo and the use of a lice comb will cure this infestation. And no matter how good the sex is, stop it until both of you are pubic lice free, and try to avoid sharing the same bed. A documented case study was about a young freshman, Joe, who contracted pubic lice after having only 2 sexual partners within his first year of university. He experienced uncontrollable itching and signs of biting after 2 weeks from direct contact with the young females. He realized he had a problem after using a magnifying glass from the science laboratory and discovering moving insects around his groin. He was treated successfully, although his ego may have been wounded beyond repair.
Moving swiftly on to our final STI, a virus. Hepatitis B. Hepatitis B is a virus that attacks liver cells, causing damage and impairing the function of the liver. It was discovered by Dr. Baruch Blumberg, who won a Nobel Prize for its discovery in 1965. Originally called the Australian antigen as it was found in an Aborigines blood sample which reacted with the antibody containing the serum of an American haemophilia patient. The incubation period is 1 to 6 months before signs and symptoms show, although people may not realise they have it, experiencing no effect. There are 2 phases of hepatitis B. The first is the acute phase, which occurs for the first 6 months. Symptoms include lack of appetite, anorexia, nausea, vomiting, low-grade fever, fatigue, yellowing of the skin, and diarrhea. Chronic phase occurs after 6 months and symptoms include liver disease. Hepatitis B can be contracted via the direct contact with blood and other bodily fluids, including anal and oral, and through pregnancy or giving birth, which can be vaccinated at birth. Vaccination for hepatitis B is around 95% effective, although not often given in Great Britain because there is little risk of contracting it. However, if contracted, regular blood tests are required to see how the virus is progressing. With acute hepatitis B, no specific medication other than over-the-counter medication for pains and sickness will treat the disease. As with chronic hepatitis B, medication for the prevention of liver damage as well as medications that could suppress the development of the virus are required, although it is unusual for this treatment to clear the virus completely. Regular liver tests on top of blood tests including ultrasounds and fibroscans and potentially liver biopsies are needed. And if the virus does progress, then there's an assortment of medications that can be used. Without treatment, 1/3 of people will go on to develop liver disease, potentially resulting in death. Cirrhosis can develop in around 1/5 of people after many years from initial contraction of the disease. 1 out of 100 people can experience a condition called fulminant hepatitis B, where the immune system will attack the liver, causing extensive damage. In 2012-2013, a case study was performed on a middle-aged woman who had a chronic history of hepatitis B with many associated symptoms. The woman was treated with a variety of medications based on her symptoms. These medications were altered specifically to how the patient responded and to the development of the symptoms. The hepatitis B virus seemed to have been eradicated within a year of treatment, also eradicating many associated symptoms. So, in conclusion,
Sex is fun, and it is exciting, and it is the only way to catch an STD. With better education, better communication, and a social shift that doesn't shy away from talking about STDs, it may be possible to make STDs a thing of the past. Although all these pathogens are sexually transmitted diseases, there are other ways in which they can be passed from person to person. Practice safe sex, and remember, prevention is better than the cure.